Hey, so it's Mike with the Thirsty Diabetic. It's been a while since we've recorded anything. I wanted to give an update in terms of the newest set of data from the FDA MAUDE database around Omnipod 5. Obviously this is a insulin pump that has had a lot of mentions anyways on social media, and rightfully so. I'm sure that it has positively impacted so many individuals with type 1 diabetes in terms of it being tubeless and some other advantages that it has. But let's look at the data, and again, I think it's important to understand that the data that I'm presenting is publicly available data. I capture it through the FDA's MAUDE API, and I'm just presenting that information. Ideally, if you're assessing insulin pumps based upon any of my videos or any of the information on the thirstydiabetic.com, it would make sense to look at the information in detail, because looking at it at a very high level in terms of the type of information that I'm presenting to you, sometimes you can lose perspective in terms of the implications or the inferences of the data itself. But I still think that it's helpful to see this information where a lot of people can't necessarily gather it. So this is the newest information for the Omnipod 5 from the FDA MAUDE database. This is only specific, not to DASH, but only specific to Omnipod 5, and this is year to date. So it's from January 1st, 2023 through June 30th, 2023. The top reported event types. And again, when I say reported, there are a lot of events, not just for Insulet's Omnipod insulin pump, but for all medical devices. There are many events that occur for all medical devices that don't necessarily end up reported. So these are the ones that are indeed reported. But you can see the breakdown, over 6 months anyways, about 7,000 malfunctions, and about, or specifically 1,137 injuries. And we'll kind of look into the detail a little bit more for the Omnipod 5 year to date. Again, year to date, that's through June 30th, 2023. The top reported patient problems, and again, reported right to the FDA MAUDE database. And there are some required reporters that have to report these events as they occur, like health systems, etc. But and I'm sure there are many of you who watch this who either use Omnipod or may use another insulin pump, for which you're like, oh my gosh, I have hyperglycemic events all the time on my insulin pump, and I never report those. Of course, these are just related to those that have been communicated to somebody that's reported. Many times that can even be the manufacturer themselves. But you can see the number of patient problems reported again through the year. You also get many that are someone has called in potentially to Omnipod for an issue around the pods potentially, and when the intake team at Insulet is receiving those calls, they have kind of pro forma these are the questions we're going to ask, and say there were no clinical signs or symptoms. But nevertheless, after that, through 6 months, there were 304 elevated ketones / diabetic ketoacidosis. Obviously, those can be quite different in terms of being in DKA versus just kind of having elevated ketones. 256 people presented with vomiting, hypoglycemic, smaller percentage, skin inflammation, irritation. If you read social media, that's one of the things I think that is a little bit more common with Omnipod versus some of the others. But again, it's related to their engineering it's more of an apples to apples comparison, but it's still a little bit apples to orange because ideally you'd like to understand, well, what are the number, what are the number of users of each pump? Then you get a sense of the incident rates per pump that's active in the market, if you will, to give you kind of a greater perspective. But nevertheless, I think that this is helpful information. There's more detail that you can find on thirstydiabetic.com. We'll have another video up here shortly for Medtronic year to date and for Tandem T Slim as well. Thanks.